Hi, Jordan Terry here again, craniosacral instructor at Santa Barbara Body Therapy Institute. Just want to go over a couple cranial moves that we'll be showing in class. Starting here with a still point induction of CV4, cervical vertebrae 4, lightly holding my fingers there and holding the cranium in my palms, allowing the occiput to rest gently, allowing the head to settle and relax. From there we can move up to one of the classic moves of craniosacral, which is the OA, occiput atlas release. It's one of the deeper moves, getting into the deep 8 suboccipital muscles there, as well as trapezius and levator scapula and everything else that comes up in there. This is one of the most common areas for tension headaches, migraines, pain, etc. This is a wonderful, wonderful area to get deep into. It also directly connects to the sphenoid. And kind of opposite of it, we have the frontal bone. Frontal bone likes to be lifted. This is an emotional center. A lot of people may have emotional strife go right there on themselves. So we can also help that out. We'll be covering the pressure stat model, which is a little bit of leaning into the bones and the hydraulic system in the cerebral spinal fluid. And as that pressure increases, it pushes back. And we follow that unwind and allow that frontal bone to lift up and out. It really helps with those headaches. We can double that up for sinuses with the frontal lift and the nasal lift, beginning to help people that have sinus issues that are always feeling clogged up. And as a craniosacral therapist, one of our goals of getting to and adjusting through soft tissue gentle touch is the sphenoid. It's also known as the keystone. It looks like a butterfly and spans from temple to temple and is behind both eye sockets. And we gently work that with about 5 grams of pressure, allowing it to move and find space, decompress, compress, do its wobble, and balance it out for general relaxation, relief, and also treating chronic conditions such as headaches and migraines. Introduce craniosacral style techniques into a spa massage, 60 minutes, bit of Swedish bit deep tissue, and as well as focusing on the cranium and sacrum. Craniosacral is a balancing of the structures of the cranial and the sacrum. We focus on these two as they are the end of the dural tube and the cerebral spinal fluid, seeking to maintain a balance or instill balance. And also we can use the metaphor of watering a garden, so that area of the garden that doesn't get watered as much, if we bring back balance to these structures and allow the cerebrospinal fluid to get back there, we can have a fruitful and wonderful garden once again. We look at the not only the cerebrospinal fluid, but the myofascia connective tissue, now that is incorporated, and looking at a very gentle, soft, receptive touch. A different touch for most massage therapists. Instead of applying the force, we are receiving that force as gravity comes down at 9.8 meters per second squared. So in this instance, I'm just doing a light hold of Nancy's cervical spine and her occiput here. The occiput and the occipital ridge being one of the most frequently pointed to areas for headaches, migraines, and general tension. So it's a wonderful tool to slip into at the end of a deep tissue massage and give a nice little occipital release. Releasing the occiput also helps release the other bones in the head, as well as C1 and C2, as some chiropractic practices focus entirely on that. Seems important enough to spend some time there as a massage therapist. We also will be looking at triggers up and down the body, neurolymph, and cross modalities such as even touch for health, and acupressure, and even trigger points and how they can be included into that. Later on in CS1 and CS2 we really get into the movements of the cranium, and then in CS2 we really get into the mouth and deep advanced work within the mouth, treating TMJ disorder, and really helping to do a full body nooks and crannies massage through soft, gentle touch, working with the nervous system. Thank you.